My guest today is Carol Proper. Carol is a professor of economics at Imperial College Business School and at Bristol University. Her research focuses on health economics and on the impact of incentives on healthcare systems quality and productivity. Carol is president of the Royal Economic Society and has just been made a Dame in the New Year's Honours for her contribution to economics.
You have been very vocal, particularly about the cost in terms of human capital and health of lockdowns, which have been basically implemented in most countries, including now potentially in many others that are going back into these measures. What are the long-term health consequences of lockdowns? Do the short-term health benefits, you think, offset the long-term health consequences? What's your sense about what could have been alternative or what's your evaluation of this policy?
Okay, so essentially what we drew attention to was the fact that when you have a lockdown, you have an economic shock, as we all know now. And that economic shock has an impact on longer term health. So essentially, there's a large literature on the impact of economic recessions on later health. And what that literature shows is that the impact of economic recessions, in this case brought about by the lockdown, on future health can be quite big and long-lasting as well. So some work that colleagues and I did for the UK showed that if you have an economic recession, it can lead to a large rise in people who have chronic and ongoing health issues, and particularly within that, people who have chronic and ongoing mental health issues. But that isn't really kind of factored in when you think about people doing the kind of calculus of what the current impact of a lockdown is. It's all in the future. But our work shows that it's not only all in the future, but it's also worse for places that already have bad health. So it has an additional inequality impact, if you like. So that's kind of the cost, the long-term health cost of having an economic shutdown. Obviously, there's a work cost, which might itself have an impact on people's mental health. So, for example, not being in work now is associated with lower mental health. We know that. So all of those kind of costs have to be set against the kind of current health gain. And the current health gain is really treating people who have COVID. And within that, really the current health gain is, in many countries, protecting the health system from being overwhelmed. And I think initially, the whole health system just shut down in order to protect people from being overwhelmed. And we had lockdowns in order to protect the health systems from being overwhelmed. I think as the pandemic's gone on, we're better able to manage the people in hospital and to treat them and to get them out faster. So I think we need to be more worried as the pandemic goes on and as we learn more about what our future health impact will be of having a lockdown to protect the current health system.
So give us a sense of this magnitude. You studied the 2008 crisis, and what's the kind of impact on health and how many people are affected, just to try to get a sense of these costs and benefits you're pointing out?
Yeah, we think that, so we looked, as you say, at the 2008 recession, which is smaller than the recessions that have occurred from COVID, quite a lot smaller. And we estimate that probably that recession from 2008 led to about 500,000 people more having chronic health conditions. So long-term health conditions, particularly mental health conditions, but also other conditions like COPD, respiratory conditions and musculoskeletal conditions that come with associated with not working and that are associated with being out of the labour market. But we think particularly it's going to affect mental health. We think the impact of the 2008 recession on mental health was quite big. We think the COVID impact might be twice that size. So possibly up to 1 million more people in Britain suffering from mental health conditions.
Do we have any sense about the equivalent figure by now for the current crisis? We have read a lot of anecdotal evidence about health issues, particularly mental health issues, as you're pointing out, children's health, kids who are not in school and are at home. Do we start to get a sense of this magnitude, or it's too early to tell?
I think it's still too early to tell, and there are some quite interesting, I mean, it's clear that there are particularly vulnerable groups, and as you've pointed out, one of them is young parents with young children, young mothers are likely to, we know women have been very affected by this pandemic and more affected, and that they've been ending up doing more childcare at the same time as trying to work from home. We also know that a lot of young women work in industries that have been particularly hit by pandemics. So there's probably going to be a knock-on effect on both their health and the health of children that they have, because they're obviously young women have children. I think it's a bit early to tell, and there are some odd features of a pandemic, which is that normally when you have a recession, it affects some people and not others. When you're all in lockdown because of a pandemic, it might be that some of the mental health problems are ameliorated by the fact that everyone is locked down. So, for example, now, you know, we're all having this debate in the Western world about what we're going to do about Christmas. Everyone is going to have a different Christmas. And it's pretty clear that after Christmas, everyone is going to be locked back in their houses, except for essential workers, because the virus is just spreading so rapidly in Europe. So I think that gives you a slightly different dimension. So it makes it quite difficult to do the kind of calculus you want to do. It is true that one of my colleagues from Imperial, David Miles, has done a very kind of crude back of the envelope calculation of the lives saved due to treating COVID shutdown, the COVID lives saved compared to the other costs. And his analysis suggests that the lockdowns will cause much bigger costs than the immediate cost of the lives that are lost due to COVID.
Mm-hmm.
But,
yeah. Sorry, if you want to finish the thoughts.
No, I was going to say, but that's quite early analysis. But I think what's very clear is we don't yet know, and I don't think we'll know for kind of 2 or 3 years as the effects rumble through, and when we see whether people can shift to other sectors to get employment, or whether there are some sectors that are just shed workers, and those workers have trouble finding new work.
I mean, a million people with mental health and other health issues is a lot. It's a lot of people. If that's the long-term consequences, we have to be very worried. One obvious lesson that you're pointing out seems to me, then obviously we need to have excess capacity in the system, so we need to build some buffers. What are other key lessons for the future that you think we should now really take into account in order to avoid this kind of changes, dramatic changes in the allocation that can hurt people with non-immediate COVID-related needs or pandemic-related needs?
I mean, I think that the key point is the one you make. You need excess capacity, not just in terms of physical capacity, but also staff capacity. Because we are going to get, as the world is very global, we're going to get more and more of these pandemics. Many people were actually suggesting that a pandemic might come at some point, especially after SARS, which people have kind of forgotten in the West because it didn't affect them very much, and MERS 2 in the Middle East. Mm-hmm. But those voices were kind of ignored, I think, with a focus on sort of daily activity. So I think in order to have resilient healthcare systems, first of all, you need capacity. Secondly, I think you need some way, which Britain is not very good at having local response. What the pandemic has shown is that places like Germany that have very strong local public health and very strong federal organization rather than very strong regional organization have managed to mobilize resources much better, have managed to do things like track and trace much better. Very centralized systems in the main don't help you when you have a pandemic, because the rate of the pandemic will affect different areas differently and different populations differently. So particularly in a centralized democracy, you probably want to design your healthcare system so you have more regional power and not have all the power at the center. It's very hard for the center to make all these decisions. And I think England is a classic example of an over-centralized system. I think the Spanish system, for example, is much better because you have a decentralized system where the provinces have more autonomy in their healthcare system. And I think that builds in safety nets.